Hi, my name is Felicia Jackson. I am going to be doing a skill assessment of a female urinary catheter insertion. Today's date is October 19th, 2025. Hello, my name is Felicia. I'm going to be your nurse today. Can I get your first and last name, please? I'll go ahead and look at your bracelet while you're seeing it. Okay, and your date of birth? Okay, thank you. It looks like the doctor put an order in for a Foley catheter to be inserted to go ahead and just get the relief off your bladder. And so we're going to go ahead and do that today. I did verify. In the system, it says that you don't have any specific allergies or anything. Is that correct? Okay, great. So what it is that I'm going to put a Foley catheter in you, and I'll just insert it inside your urethra. And like I said, it'll relieve the pressure on your bladder, and the urine will come out. Okay? Okay, first I'm going to start by just simply cleaning you real quick down there before we get started. So I'll clean you twice. I'll clean you beforehand, and then as I'm getting everything set up right before insertion, I'll clean you again with my iodine, okay? All right, great. So I'm gonna go ahead and put some gloves on. I did bring all my supplies in, so I have some soapy water, and you can use some wipes as well right here. So I will just say I have some wipes right here, and so I'll use this bottle as for the female. So I will go ahead and get my wipes out, and I will get about 3 or so out, and I would hold the labia open, and I would get one wipe, and I would wipe down one side. I put it in the trash. I get another one. I'd wipe down the other side. I put it in the trash. I'd get another one, and I'd wipe down the middle real good and put it in the trash. You can also repeat this again if need be. Sometimes you do have to do it a couple more times. And then after that, I will discard my gloves, get everything out of the way and situate it, and put it in the trash. I will make sure that the bed is in a position that is good for me for insertion, as well as safe and comfortable for the patient. I'd make sure that she was in a position on the bed properly so that insertion can go as planned. Okay, so here's the kit, and this is what I'll be using. And due to the bed not actually being big enough, we're just going to put it right here. So I will start by taking everything out. I like to use the bag for trash. And because the area, like I said, is not big enough, I'll just put it on the floor. And that's what I would use as trash, and I would just put it more close to me. And then just discard the paper. You can open this up. Continue to make sure that you're touching just the outside or the corners, just so that you do not break your sterile film. And then I will come over here and get the drape and put the drape underneath her. I'd have her to raise her hips and put the drape underneath her, like so. And then you have your sterile gloves, and you kind of just pick them up without touching anything else, and you come over here to the side, so that way you're not over your sterile film. You'll have your gloves and open them up accordingly. Again, making sure that you don't break your sterile film. I'm sorry, my gloves have flipped. So let's take it like this, making sure that I'm still holding the inside of the cup. And then I would just let it go. And with the sterile glove on, I pick it up, make sure my fingers are between the cuff, the outside of the cuff, and where the fingers go on the outside of the glove as well. That way my hand doesn't actually touch the outside of the glove. And I put it on and do like so. After I've got both on, they're both sterile, so now I can adjust my gloves if need be. And then you just take this and just throw it in the trash. And then this is just a drape that you could drape over that has a hole that would expose the female tract. But I normally just throw that in the trash. And then you go ahead and get your station set up. You have 3 iodine Q-tips in here, and I would normally open that up and then drop the top in the trash, making sure that you don't go back over your sterile field. Open it up over your sterile field, though, is in case you drop it, so that way it'll still be there. And so you can just place it like so. And then I would also do the lubrication. I would take the top off and squirt the lubrication in here. It's got a little, a couple of little reservoirs in here that you could do such. And I'm able to touch all of this because my gloves are sterile. So I would take gently and very carefully so that it doesn't move around, but still over my sterile field. I would take this and I could just drop this in the trash. I would take the tip and place the tip in the KY jelly for lubrication. And as you see, it's still over the sterile field. Then for the saline, you can just drop that there. I would go ahead and already connect it. Generally, you just go ahead and check and make sure that the bulb on the catheter does work before you do insertion. And so at this time, now I would take my non-dominant hand and I would open the labia. I would get one Q-tip and I would go down one side, making sure not to go across my sterile field again. I would drop it in the trash. I would get another one, go down the other side. Again, drop it in the trash. Get the last one and go down the middle. Again, drop it in the trash. After that, I will go ahead and let the patient know, but I have to keep my hand here because at this point, this hand over here that is on the patient is no longer actually sterile. However, I still have my sterile field here, so this is still there. And so what I would do here is I would continue to hold her open, and then I would insert this into the urethra about a good 2 inches. And at this time, I can use my non-dominant hand. Once I get it in where I need it to be, then I can use my non-dominant hand to hold it, to hold it in position. And then I will go ahead and, with my still sterile hand, I will go ahead and gently push the saline into the bulb, making sure that it's going all the way in there. And then at that time, I can just pull back on it until I feel resistance. That way I know that it is seated at the bottom of the bladder, and I could just bend this over a little bit to pinch it, the line off, and take the saline off. And at that time, I will go ahead and get everything out of the way because everything's done for the patient. So I would put all of this in the trash. I would discard of this whatever way the policy and procedures state for the facility that I'd be working in, or the clinic. And then I'd make sure to unravel everything and make sure that urine is flowing. I would get the hook and connect it to the bed, making sure that it's below the level of the bladder. And then also if I needed to collect urine, then I would get alcohol wipe. I would get alcohol wipe and I could go right here with the needle and I could kind of like pull back on the needle and get urine in there, and then I could put it in the specimen cup that was provided in the kit. After everything is done, I'm gonna go ahead and just put this back up here because it's trying to fall, but you would make sure that it's not still in the bed with the patient. After everything's done, then I will go ahead and discard my gloves, all the trash is in one spot, discard my gloves. Most of the time there's a sink, so you go in and just wash your hands real good, and you get your trash. Well, before getting your trash, you want to make sure that you lower the bed back down so that the patient is safe and it's at a spot for the safety of the patient. Make sure you check on the patient, make sure there's no pain. You also want to make sure there's no pain after insertion. Generally there's discomfort during, so make sure there's no pain after insertion. no pain now. Make sure that you drop the bed to the lowest safe spot, and make sure that you give the patient their call light. And I would gather all my trash and get everything. I would sanitize my hands again on the way out, and then just again, like I say, make sure the patient doesn't need anything else, and then I will go ahead and exit.